Why don't I be Michael Griffin now?
Hi, hi, everyone. You can mute your lines, please. Thank you. Hi, everyone. This is Jonathan Modi. I'm with Oregon Health Authority's External Relations Division. Thanks for joining us. This is a media briefing for members of the media to hear from Dr. Paul Cieslak of OHA and Dr. Sarah Present of Clackamas County about the current measles outbreak and to ask questions. Just a few reminders. Our speakers will make brief opening remarks and then we'll turn it over to questions. We have until noon, but we'll end this briefing early if questions trickle off to dead air here. So just a reminder to please include your media affiliation so we know you are with the media. This media briefing is reserved for the media. If you're not a reporter, you can view a recording of this briefing on our website later today. We also ask that you log off now and head over to our YouTube live stream. And then there is a link in the chat to the live stream. If you want to ask a question, please use the raise your hand function when we get to questions to be added to the queue, or feel free to drop a question in the chat and I will ask your question for you. Please mute your audio when you're not asking a question, or if you're when you're done asking a question. We will take one question at a time. And if you'd like to ask a follow-up question, we will take it when everyone has had a chance to ask their questions. If you'd like a recording of this media briefing, as I mentioned, we will have a recording after this is done. The recording will be the YouTube live stream link. So it's currently for the live stream, and that will be the same for the recording. So you could just use that. And so with that, I will turn it over to Drs. Cieslak and Present to kick things off.
Thank you. Hi, I'm Dr. Cieslak with the Oregon Health Authority's Public Health Division. We're here today to tell you about ongoing transmission of measles within Oregon. We'd issued a couple of press releases earlier, and we're here today because the transmission continues. We've had several waves of measles cases since the middle of June, so now about 2 months of sustained transmission of measles. The transmission so far has been limited to areas in Marion and Clackamas counties, and we've had one case in Multnomah County as well. This is the largest measles outbreak that Oregon has seen since 2019. The year just before COVID, we had 28 cases during that year in association with a much larger outbreak in Clark County, Washington, across the Columbia River. And before 2019, you have to go all the way back to the early 1990s to see case counts this high. The reason is that we had maintained very high vaccination rates and very high population levels of immunity. Unfortunately, we've seen an erosion in the percentage of people who are getting vaccinated against measles. Since about the year 2000, more and more parents are choosing exemptions from vaccination requirements for their children. And we measure this at kindergarten entry. And before 2000, about 1% of kindergartners would claim an exemption from school vaccination requirements. Since that time, the number has risen rather steadily. And in the most recent school year, 2023 to 2024, the exemption rate has been 8.8%. And that is threatening our herd immunity, so-called herd immunity or community immunity to measles. Measles is perhaps the most contagious disease that we know of. It's spread by the airborne route. If someone with measles coughs into the air and you walk into the room an hour later, maybe even after the person has left, you could contract measles if you are susceptible simply by breathing the air that that person coughed into. Virtually all susceptible household members of a case of measles are going to get the illness. It's that contagious. And so it takes very high levels of population immunity in order to stem the transmission of this contagious disease. We had achieved that in the United States. Measles was declared eliminated back in the year 2000. We went several weeks in our whole country without seeing any cases of measles. And we knew we would occasionally see cases as they came in from overseas. We all know we're part of a global community, and other countries had much higher rates of measles than the United States did. And we've seen many introductions of measles into Oregon since that time, but transmission hasn't been sustained in general. The virus will keep running into a wall of immune people because of vaccination. The measles vaccine is highly effective. This is one of our best vaccines. 2 doses provide 97% immunity against measles. And if enough people are vaccinated, we can again stop transmission within Oregon. The fact that we've seen such sustained transmission over 2 months means that at least in these parts of our state, we don't have enough vaccinated people to stop the transmission. And so it goes on, and as of now, we don't see an end to it. Many people may think, with some accuracy, that they're not at very high risk for measles because we haven't seen transmission, and so they may have avoided getting vaccinated for that reason. But we're here to tell you that as of today, there is measles transmission in Oregon. You are susceptible. You could get it if you're exposed. People are contagious with measles for up to 4 days before they show the characteristic rash of measles. So someone could not even know that they have measles yet and be transmitting it for 4 days, out in public, taking public transportation, in a grocery store, wherever, and you could be exposed in that way. And that's why we recommend highly that everybody be up to date on their measles vaccination. In a few weeks, school will be starting, and because measles is now being transmitted, the children who are susceptible to measles may find themselves excluded from school should there be an exposure there. And the exclusion would be for 7 to 21 days after their exposure. So if your child is under-vaccinated, now would be a great time to get your child up to date on measles vaccination so that you're not looking at exclusion from school should a case of measles appear there. If you develop a rash and you are susceptible to measles, we ask that you not simply drop in on an emergency department or on your doctor's office where you might expose other people. We ask that you call ahead of time and arrange to be seen where other people wouldn't be exposed, and you could be evaluated and tested that way. People with measles, with the rash, should stay at home until at least 4 days after their rash onset. After 4 days, you're no longer contagious. So that's what I have to say today. Dr. Present.
Thank you so much, Dr. Cieslak. Again, I'm Dr. Sarah Present. I'm the health officer for Clackamas County, and I am a member of the Tri-County Health Officer Program that also includes Washington and Multnomah counties. I'm also a family physician, and I provide primary care in our Clackamas County Health Center as part-time. So in Clackamas County, as in other Oregon counties, pockets of unvaccinated people raise the risk of infection in the communities where they live. That's why the counties reach out to every case that's identified and try to determine exactly where they've been while they've been infectious. As Dr. Cieslak said, it's important to remember someone with measles can be spreading it up to 4 days before that typical rash appears, and their symptoms may be mild during that time. So OHA and the counties will share information about specific locations that we can identify that individuals are known to have visited so that we can let members of the public know that they may have been exposed to measles. You can look out for press releases or on our websites for locations of potential exposures. And we continue to collaborate on identifying any potential locations as new cases arise and our epidemiology investigations continue. As Dr. Cieslak pointed out, it's really an important time to make sure that students and their families are up to date on vaccinations as we go into the new school year. I want to talk a little bit about what local public health does if there is a case of measles in a school or in a healthcare setting. So if a case is confirmed in a school or childcare or in a healthcare setting, the public health department will perform a detailed investigation. This involves working with the administrator or the clinic leadership to identify who might have been exposed. And anybody in a school can be exposed because it is so contagious. It could be the entire school building that might have had exposure to that one case. We identify who is unvaccinated. So we review all of the staff and student vaccination records that the administrators have, and we communicate who needs to stay home. We also will work with the school or healthcare facility or childcare facility to communicate about the situation to their communities. Keeping children in school and childcare is an absolute priority, but measles is a serious disease. It's not just a little rash. There are very frequent complications, and up to 1 to 3 in every 1,000 children who get measles can die from it. An unvaccinated person who's exposed to measles will not be allowed to go to school or childcare during the period when they could become sick. And this is usually for 21 days after the exposure, which actually may be extended if there continue to be cases in that school. They're asked to stay home to avoid exposing others in the community. For school teachers and other staff members or healthcare workers, if an exposure occurs in a healthcare setting, your employer may not have your vaccination records. And public health will really want to ensure that it's safe for everybody to be at work. So if you work in one of these settings and you have been vaccinated, now is a really good time to locate your vaccination records so that you can have them on hand and not have to miss work. If you can't find them, you can even talk to your primary care provider about getting a blood test to prove your immunity so that you won't face time off work when you're not truly at risk. Exposures in these settings can lead to lost vacation time, lost work time, and can potentially be very, very challenging for families. We do try to work on ensuring you have resources, but it can be a significant burden to not be able to go to school when you're exposed to this illness. Of course, the burden of getting the illness is greater. Like I said, it is a serious disease that has multiple complications. So now is the best time to make an appointment with your healthcare provider and get your family all vaccinated with the MMR vaccine, which is one of our most effective and one of our safest vaccines. It's been used in this country for decades, since the 1970s, and has proven to be safe and effective. The counties are working to ensure that everyone has access to the vaccines who may need them. I know Marion County is setting up drive-through vaccine clinics next week at the Marion County Health and Human Services site, as well as at John F. Kennedy High School in Mount Angel. Clackamas County Gladstone Health Center is having a fair tomorrow from 10 to 1 with some vaccine availability. And Clackamas County Public Health is actually reaching out, our immunization team is reaching out to many of our private schools, which tend to have higher exemption rates, meaning lower vaccination rates. And we will be offering on-site vaccination clinics if there are school communities that want to take advantage of that. We really are here to make sure that people have access to this safe and effective vaccine. Really don't want people to take a chance with measles. It's not something to mess with. So we encourage anyone who has any questions about their risk, about whether they've been exposed or what their vaccination status is, to talk with your healthcare provider. And I think that's all I have as well. Happy to pass it over to Jonathan.
Thanks, Dr. President, and thanks, Dr. Cieslak. Once again, if you'd like to ask a question, please use the raise your hand function to be added to the queue, or feel free to drop a question in the chat, and I'm happy to ask a question for you. The raise your hand button is down at the bottom of the page, right next to reactions and apps. So feel free to ask any question you like. Okay. Our first question comes from Sydney Dorner with KGW News. Go ahead, Sydney.
Hi, thank you guys so much for speaking today. I just wanted to clarify. So if someone has gotten their 2 MRI vaccinations, they have a 97% protection against getting measles. So you use that example of someone being infected with measles, right? So if someone vaccinated came in contact with them, what would be their exposure levels?
Right. So 2 doses of measles, mumps, rubella vaccine, MMR, are 97% protective. So whereas, a close contact exposure, being in the same room with the person, especially if you're there for, several minutes and any significant length of time, you have nearly a 100% chance of contracting the infection, but you can get rid of 99% of that risk with 2 doses of MMR vaccine.
And sorry, one more question. What would you guys have to say to people who are getting vaccine exemptions for religious reasons? What would you recommend to them if they really feel like, they don't want to get this vaccine?
The only thing I can recommend is that they try to avoid exposure, but with a disease that's this contagious and that can be spread before you're even aware that before the person is even aware that they have it, it's pretty difficult to avoid. Back in the pre-vaccine days, virtually everybody got measles. The number of cases per year was about the number of births per year. So at some point, virtually everybody got measles, and as Dr. President noted, 1 to 3 per 1,000 would die of it.
I'd like to add that when I interact with patients of mine who have questions about vaccine, I really am able to have a conversation with them about what their concerns about those vaccines are and try to make sure that they actually have the best and most accurate information. So if somebody is questioning the MMR vaccine, I really encourage you to talk with a trusted source, a primary care provider. Boost Oregon or the CDC have really high quality and scientifically based information on the safety of the vaccines. So I would say, talk with your provider and really question why you are concerned about it and see if you are truly getting the right information or not.
Thanks, Sydney. Next question comes from Isabel Funk of Statesman Journal. Go ahead, Isabel.
Hi, thank you all for being here. I have 2 questions, actually. My first question is, if a fully vaccinated individual were to contract measles, would that vaccination provide any protection on the severity of the symptoms they would experience?
The answer is yes. If you have immunity that is not complete, doesn't completely protect you, only gives you partial immunity, you would probably develop a milder case of measles. We would call it modified measles. And you'd be much less sick and probably much less contagious.
Thank you. And then my second question was a follow-up to Sydney's question. Dr. President, you mentioned that you've often been able to talk to people who are concerned about those issues. What are the primary concerns that you hear from people who are unsure about the vaccine?
I think the primary concerns are that people have heard information that suggests that the vaccine is not safe itself and that vaccine causes problems. And most of that information is false. So there are some very common concerns about the MMR vaccine related to things such as autism, and that has been disproven. That is not true. There's a lot of science that looks at this, and we can be confident to say that risk is not a true risk. We do, anytime we get a vaccine, our immune system responds. People can get mild fevers, you can get some body aches anytime you have a vaccination, and that's what your immune system is doing to help protect you. But you cannot get the disease from the vaccine, and it does not cause the long-term effects that much of the misinformation about this vaccine states that it does.
Thanks, Isabel. We have a follow-up question from Sydney Dorner with KGW. Go ahead, Sydney.
Yeah, so my first question is, how many people would need to get vaccinated in each of those 3 counties for us to get back to herd immunity? And then my second question was, you said it takes 4 days typically for a rash to appear. Are there any other symptoms that may pop up in that interim?
I can talk about vaccination rates real quick
ahead,
first.
President.
So I do know that in Clackamas County for the 23-24 school year, 91% of kindergartners were up to date on their MMR. And then if you look at all K through 12 students, it was 94.4%. So if we have a goal of 95, for the younger kids, we've got a ways to go. Those vaccination rates are higher in public schools than in private schools. I could say in Clackamas County, looking at all of our private schools, we're under 80% of kindergartners were fully up to date. So we have some work to do there. I think Marion, Multnomah, and Washington counties are slightly higher in their rates, but we, like I said, we have some work to do to get to that 95% goal that really is the level that the virus will keep engaging with people who are immune. So it will stop the spread if 95% of people are immune to it.
I'll take the question about symptoms before the rash. So there is sort of a classic, what we call prodrome, which means preliminary illness before you get the rash. And it's fever, cough, red eyes, and stuffy nose. So those are the symptoms that we would want you to look for if you were susceptible to measles, and certainly if you were exposed to them. So those symptoms followed by a rash is likely to be measles, certainly while it's circulating here in Oregon.
I think one of the things that many people don't know is that the fever can be quite high. It's often like 104 degrees or higher, which is somewhat unusual for a viral fever. Again, measles is more than a rash. It can be quite severe.
Thanks, Sydney. Once again, if you'd like to ask a question, please use the raise your hand function found at the bottom of the screen to be added to the queue. And also, once again, feel free to drop a question in the chat, and I'm happy to ask it for you. I'll just wait here a minute. I don't see any questions as yet. We'll do another.
I'll
go ahead.
Yeah, I neglected to sort of give some of the basic epidemiologic details in my beginning spiel. But we have 25 cases to date, again, over the past 2 months. All 25 are unvaccinated persons. 16 of them have been residents of Marion County, 8 of Clackamas County, and 1 case in Multnomah County. 5 of the cases are 20 years of age and older, and all of the rest are under 20 years of age.
Thanks, Dr. Cieslak. And a reminder that we did have 28 cases, I think in 2019 was our last big outbreak. Okay. Well, not seeing any other questions in the chat. Let's see, just one last call for questions. Okay, well, it looks like we'll wrap up this media briefing a little early. I wanted to thank Dr. Cieslak and Dr. President for the remarks, and thank you to everyone for joining us. If you have any other questions, please email our media inbox, which is phd.communications@oha.oregon.gov. That's PhD as in Public Health Division .communications with an S at oha.oregon.gov.